for any case, especially a long case and especially in laparoscopic cases. This number here, this is our end tidal. So end tidal tells us, you know, we want to keep them, I usually like to keep them around 30 if they're paralyzed for the case, maybe a little bit less than 30. And that's a number that we use to make sure that they're ventilating well, to make sure that they're breathing adequately, that they're getting enough tidal volume, and that it's not too low. We want to usually keep them around 30 to 35. Every provider, anesthesia provider, is a little bit different on that school of thought. And then next, up here, you have your monitors. So we have our blood pressure. We have our, it's not connected right now. This is also end tidal, going to show us our end tidal. And then, like I said, it's not connected, but we have our oxygen saturation. And then when they're connected, we have their EKG leads. So we can monitor any EKG changes that may occur during surgery. Also up here is their heart rate and temperature monitoring. It's important to monitor temperature. Patients in the OR, you know, the ORs are normally pretty cold, so we like to keep them warm, usually with a bear hugger, and then monitor their temperature to make sure that they don't get too cold during surgery. Another important part of your anesthesia setup, and I should have mentioned this in the beginning, is I always use an acronym. It's called MSMAIDS, MSMAIDS. Yes. So it stands for monitors. Check your monitors. Check your suction. I always like to keep my suction here at the top of the bed. Just make sure it's turned on and that it's working. That way you can have it available for you when you're ready to intubate, if you need to suction the patient, anything like that. So monitors, suction, airway, which I already showed you, the airway here. I always like to keep a little oral tube out in case they need that for when I'm masking them.